Welcome, everybody. I decided today, this live, in regards to quality of care that people get from doctors, uh, anything like that. If being that it's a hospital, doctor's office, wherever you get care from, and something's wrong, you feel sick, or you feel that something's wrong with you, have no answers to, you tried every over the counter possibly try, and the result is nothing. So what do? You contact your doctor, or you now while you're there, you're expecting to get the best quality of care that you possibly could get. Hell, let's face it, you want to get better. But then you put your faith in these doctors and nurses, thinking that, hey, dire straits here, they'll be able to help me. Well, is there a line in which they will give you quality of care? Is it based on your health in general, or based on the color of your skin, demographics, and how you handle the early? Well, let me tell you guys something. I believe, in my own personal experience, by looking at a recent episode of The Resident. You guys haven't checked The Resident out? I suggest you do. Very good show. It is on Fox. It comes on Mondays. Shout out to Fox on this one. Care about monetization at this point, because this needs to be said. And the show brought it out. I'm not hearing any more in regards to this issue, but I give them kudos on even broadcasting something like this, because it's a hush hush situation when it happens in real life. People don't want to talk about race. People don't want to associate race with healthcare, but you know what? It plays a big part of it. There is discrimination in the healthcare system. There is. If it's the amount of care you get, if it goes down to the plan you got, it all ties into race. Let me explain. I just finished watching an episode of The Resident. I'm not sure when it was broadcast. I think it was sometime in this month, earlier this month. I just started to catch up on my show, and I saw this episode where this African American woman, her husband came in. She's complaining she's pregnant. She's complaining of issues, with pain and everything in her belly. And so they did a little, common exam. The I guess the acting obstetrician on staff did this little, little exam and whatever. And no, wait. I think it was a resident. Is Dr. Pavesh. Dr. Pavesh is the doctor here. He did his little exam, and he said something about, the baby's heart rate is not where it needs to be. Get a sonogram done immediately. Brought in the sonogram, saw that the baby was something was an issue with the heart rate, so they decided to go in and do a cesarean. Anybody that is a mother and had a cesarean section knows that all it basically is incision that they make across the below the belly, and it's like where the cervix is, and they pull the baby out that way rather than having the baby naturally. All right. So they did the procedure. They got the baby out nice. The baby came out very fine and healthy. They sewed the mom back up. She's excited. She saw her baby mother. Let's get it right. Her husband was there. They're in tears. Dr. Pavesh was in the car with her, and he cheering for her and on her side the whole time. Let's get this straight. Dr. Pavesh, which is this kid right here, was on their side. He's not the doctor I'm about to speak on. Okay. So as they get wheeled out of the OR, everything's great until mom started feeling pains in her belly, and blood was in her bag, her colostomy bag. A colostomy bag is something they put in put in your, where you pee, the back with that term, and you read that, and it allows urine to deposit into this plastic bag. So as Dr. Pavesh was looking, he saw that there was a fair amount of blood in the urine, and he went to the doctor who actually performed the cesarean section. There's quite a bit of blood in her urine. And what did the doctor say? The other doctor, he said, oh, that's normal. She just had cesarean section. That's normal. With any, cesarean section I've seen, it's normal. Dr. Bavesh says, no, I don't think that's normal. I think that we need to look into this further. That's not a normal thing. So, the other doctor, once again, said, oh, it's normal. But let's go back to the OR. Before all this was done, you know what he asked Dr. Pavesh? Dr. Pavesh, when did you get into this? Dr. Pavesh said, I was born here. Oh, doctor said, oh, good for you. Now, all of a sudden, now you know that he's a racist doctor. Why would you ask another doctor of a different race, when did you come into this country? I don't know. This doctor could have been born here. Back to Dr. Pavesh telling them that's a problem with the blood in the urine. So the doctor said it's normal. The nurse who was under this doctor said, oh, that's standard for any person that had a cesarean section. Now, Dr. Pavesh was worried. He's like, look, I really need you to look into this. This is not normal. So he went against the doctor that decided to go back in the maternity ward where the husband was waiting. And there's something wrong with my wife. She's complaining of her belly pain and her blood, more blood in her urine. So he went back to the doctor and the nurse and said, hey, we need a CAT scan done. This is not normal. And they said, well, we tested her blood pressure, and it's low, but it's low normal. When has anyone ever say, oh, low normal? There's no such thing as low normal or high normal. It's either there's normal, low, or high. This is where they get you at. Pay attention. Listen, people. This is where they get you at. I'm talking about my people of color that happens to have a health issue. This is where they get you. They make you believe that is a low normal and a high normal. There's no low or high normal. There's either normal, low, or high. That's in regards to tests, blood results, whatever. There's either low, high, or normal. There's no such thing as low normal or high normal. I don't give a crap what any doctor has to say. I care less about it. All right, let's get to it. So he said, well, no. If her blood pressure is low and she has blood in her urine, that is not normal. That's not normal at all. So Dr. Pavesh rushes in. He says, no, I want an ultrasound in here right now. He did an ultrasound. Now mind you, no, he didn't do the ultrasound yet. Sorry, guys. What happened was he left and he said, well, okay, he was about to go. And what happened was the husband came back into the nurse station and said, man, something's really wrong with my wife. She can't stop shaking and all this other stuff. So the nurse says, that's... No, something's not right. And Dr. Pavesh happens to walk back in. He says, please, stop this with my wife. Dr. Pavesh walks in and she's shaking, she's cold, she's in bad shape. So he did another ultrasound. He said, let me tell you, now the urine is no longer tingy, orange, yellowish, color. It's now straight up blood now. They're still hollering, oh yeah, that's normal. No, it's nothing normal about that. So what he does a quick little ultrasound and he finds that there's something wrong. There's a lot of blood in her stomach. She has internal bleeding now. So he says, no, we need to get her a CAT scan immediately. Okay, get the doctor right now. Tell him we need an emergency CAT scan right now, not tomorrow, not next week, now. So the nurse gets on the phone with the doctor and she waits and waits. Okay, he comes back. Okay, what is the results of the CAT scan? Oh, it wasn't done yet. Why? And then now, mind you, this is hours by. They're just like chilling right now. Okay, so next thing you know, she's in trouble. So you know what he does? What? I'm gonna take over now. And he said, let me call the doctor. He calls the doctor. The doctor's doing another cesarean section. Your patient, I forgot her name that was on the show, but your patient is in dire straits and needs a CAT scan. I need that authorized now. And he said, oh no, that's standard, that's normal. No, there's nothing normal about it. I need a CT now. Now he's beating around and he said, you know what, Dr. Professor, please tell me I'm not one of those doctors. And the doctor says, what you mean, those doctors? Doctors that are only sensitive have the same skin color. Now, the doctor that did the cesarean section is Caucasian. Dr. Pavesh is Indian. So he's like, please tell me you're not one of those doctors that only base priority on the color like you. Like, no. Getting out of the fence and he said, so it's getting late now. And what happened? They I forgot if they put her in a CAT scan machine or not. Yeah, I think they did. And they come to find out she's full of fluid, full of blood. Her stomach's full of blood. Get her to the OR. She's bleeding. Doctor that does cardiothoracic was in there. I'm thinking at this point that she'll be saved, but husband's waiting. He rolled her in the OR. She's alert now. She's like, baby, please, I'm scared. He's like, don't be scared. Right here with you. He's, I'm going with her. Dr. Professor, I'm not leaving her side either. So as they're going in and going towards the door, I was like, please don't leave me. Dr. Professor said, I'll be there for her. I'm right there with her. Husband stays back and he's worried. He's crying. Turn on his face. So in the OR, they're doing the best to stop the bleeding. It was so much blood. It was ridiculous. So time goes on. The husband, it goes back to the husband. He's sitting at the OR doors waiting for the doctors to come out to tell him, okay, your wife is fine. We stopped the bleeding. He wants to hear something positive at this point. Doctors come out. It was Dr. Babesh, this cutie. Dr. Okafor, her. To try to save her. They all three of them out. They were not smiling. As long as I watch the resident, anytime there's something wrong, they come out and tell them that they did everything. I cried when his husband, and they hugged them. After all that said and done, the hospital came to see the husband. About 1 million apologies. I apologize. It's not apologies in the world can actions of one doctor. Felt like her crisis was not a priority. Like, rather just let her suffer. Exactly what happened. Told the chief of the hospital, hey, look, race, nothing but. The doctor's like, no, I don't think so. I've known this doctor for a long time. They said, no, you don't speak it. Say it out loud. There's a lot of doctors out there that are racist and biased. The bad part about it is people don't know which one. I have no idea which doctor it is. I don't know. When I saw this episode, I was cheering so loud because you know what? I thought, yes, it's not just me. This, and let me tell you something. I have been through so many doctors, back and forth through so many doctors, that it is utterly ridiculous. At this point in time, I've been waiting on my new power chair for months. When I say months, I mean from November to now. I have yet to receive this chair. Because these doctors don't want to put something so simple, something that they are aware of in the doctor notes. Just for me to get this chair. They're making it super difficult for me to get this chair. Not only that, they're refusing to give me the medication I need to slow down the progression of my scleroderma, my lupus, and every other autoimmune disease I do have. Not to mention, I just gained 2 more. Since the last hospital visit I had on the 14th of this month to the 16th of this month, I've gained 2 more autoimmune diseases, and I'm only taking 1 prescription for. I have heart failure. They swear everything's normal, but when I read the results, nothing normal about it. My pulmonary arterial hypertension is sky high. My blood pressure cannot regulate itself. It's either low or supremely high. Now I have issues with my blood sugars. They're always high. And it's like, okay, what are you going to do about that? Oh, that's normal. Nothing's freaking normal. And another reason why I say because I'm black is because the hospital will not release. Now they released the CAT scan of my chest. They not my heart, not the echocardiogram. An echocardiogram is like a sonogram of the heart. It tells you everything you need to know. Okay? They have not yet released that. Funny, right? They have yet to release that. Yet to release it. I had a rheumatologist that wants to rule out all my autoimmune diseases, which is the course of 3 years. Why? I've been searching my Facebook timeline, and I'm seeing a lot of my autoimmune brothers and sisters that is of color die more than any Caucasian person with autoimmune disease. How is it that Caucasian people have autoimmune diseases? Not their fault. Not their fault. It's all their doctor. How is it that they're able to sustain and slow down their progression while we, African American men, even other people of color, other countries, die from the same freaking thing? How is it that they can slow theirs down, but we gotta die, right? Why? Because not white. I am sick and tired of being quiet about this because it's happening to me. They refuse to treat. They lie. I've had a hospital doctor and falsify records so they won't get in trouble. I filed a complaint through Pro is an organization that finds and handled complaints about the quality of care you get from a hospital. I went to the hospital on crap. They wouldn't help me. They wouldn't help me out of bed. They wouldn't do anything. They put me in a room with someone that's sick. Now, me having several autoimmune diseases, I can't be in the same room with another patient. Because anything they have, I can catch easily. They're supposed to put me in a private room. Nope, they won't do that. So when Pro investigated, they doctored the notes to make it seem like they did everything they supposed to. And they did not. I said, you know what, Pro? They're lying. They are lying. They changed my notes so they won't get in trouble, but they can continue to keep patients like me of color like this. And there will be more deaths in this hospital of people of color than anywhere else. I just got out of the hospital not too long ago, and I've had the nicest nurses in the world help me. The cardiologist that was white treated me like a piece of crap. You hear me? He didn't want to say anything about my results. Then as I'm leaving, he knows I can't walk. He knows I can't do that. He tells me, do me a favor. Yeah. Walk a couple blocks. I said, what? I said, you know what? I got nothing to say about that. And yet have I heard about that complaint. Crap, if you don't care or not. I do. Because I'm in this situation and there are millions of other people in the same situation. racism when it comes to health care. I don't give a crap what any doctor try to clean up. I don't give a crap what Big Pharma has to say. I could care less. There is racism in health care, down to the plan you got, down to the doctors that's on there. They are racist as hell. Now, you could be lucky to find somebody that cares about your health and you rather than the color of your skin, but that's highly doubtful. It is very hard to find those type of doctors. I have not found one yet that cares enough about me to make sure that this disease slows down. Not one. Not one. Because I'm black. I think that fascinating African American people. There are more assassinations and murders in hospitals of African American or any other race descent. Has anyone ever looked into that? How many people of color have died in hospitals versus the Caucasian population? Anybody can tell me that? Anybody? Highest number, not just basing it black. I'm basing it on all kinds of nationalities that have. I'm talking about patients that are not Caucasian. These are the patients that are not receiving the proper care that they deserve. I'm seeing more people die from lupus. Why is that? Because priority to Caucasian patients than guys. An alarm out there. If you happen to feel any type of racism or you're feeling like you're not a priority and doctors are giving the highest quality of care to someone that have the same skin color, I suggest you investigate and you file a complaint if it goes any further. Do not be afraid to stand up for your health, because guess what? It's your health, it's your life. Do not be afraid to stand up for yourself rather than be quiet and die. You hear me? Enough of this. No one's talking about this. Nobody, anybody on YouTube, I don't hear anybody talking about this. They rather talk about celebrity gossip. They rather talk about everything else, but no one's touching on this. You know why? Because they don't get. No one gives a shit. But you know what? I do. Enough already. I think these doctors need to be investigated and called out on their bull crap. I need numbers. I want to know how many people died under your care, doc. How many were there that were black or people of color? Versus, I got nothing against Caucasian patients, because you know what, they need quality of care now. It's not their fault that their doctor are picky and choosy over who they give quality of care to and who they don't. It's not their fault. Please understand. It has nothing to do with the patient. Doctor. The doctor has the hand in anything and everything, and his nurse does also. Do you know that nurses are tied to what the doctor tells them? Excuse me. Even if they want to help, they can't do it because they're under the orders of the doctor. So not only does he provide quality care through him, he does it through his nurses. Just want to help. Lucky that is. Lucky that is. You want to help a patient, but you can't because your doctor got specific notes not to. Let me tell you something, guys. If you can't get handed those notes, they change a few things in there. All warm and fuzzy. I guarantee there's some in there that you are not. Don't help this blackie. Help this Indian person. Don't help this Chinese, Korean, whatever color you are. Don't help them. Do not help them. I don't care if I piss some doctor. No fucks. I'm fresh out of fucks. My life, my duty to call alarm to it. Open up the discussion. Thank you, Fox. Thank you, the resident. This episode needs to continue to. These doctors need to be. Hospitals need to be held responsible. Healthcare that we pay pounds of money to have and make it difficult. Why can't they pull records? Why can't they do audits? Where is that? I want numbers. I want audits. I want, along with the doctor's name, profession, MPI number, I want the entire record for public view. If they do that, focus, nasty, biased, racist doctors that are out there killing people. Basically, they're murderers who get away with it. Black or Chinese or Indian, whatever color they are or whatever race they are that's not white, they can sit right there and look at all the results and all the tests that they did. This person could be fixed. This person could be cured. This person could be, the life could be elongated. But you know what? They're looking right at it and they know, well, if they don't make one move, they can die. They know. A lot of times they're being paid by health insurance companies and big pharma to shut up, and they'll take the money. Oh yeah, you guys didn't know that? Doctors, hospitals, and any type of primary care physician, they get paid to not tell you that you go. They get paid to shut up, and they'll take the money. Oh, they'll take it. You could be sitting right there thinking everything fine. The doctor has your chart to say, oh no, this heifer gonna die. Well, if you do this, not to perform that procedure. Big money. Do you know if you go into the emergency room as indigent, have any life insurance, no, any health insurance, you know you're gonna be sending a big ass bill, they still get paid. You didn't know that, huh? That hospitals will still get paid regardless if you have insurance or not. A big check. Government and state. How do I know this? Studied on it, people. Honors. I know my. That's why these doctors can't play me. Me with that shit. I train another doctors to say over and over. I'm black. Fuck me. I didn't teach you anything. Are one of them. Guys, really, really have to make sure you get copies. By law, you can not let your doctor's office or hospital tell you that you cannot get your records or the notes. Yes, you can. If they refuse to put it in your patient portal, you take your happy ass down to the doctor's office and request those. They may charge you. Oh well, I want every single note, every single result, every single medical record on me possible. They have to give it to you by law. You know what test you took. Any test you take, write them down. Write down what test you took and the date. So they can't say, oh, I don't have it. Yes, you do. Track of your medical records. job is of every single one. Not be intimidated by these doctors' offices or hospitals. Make sure you get your information straight so you have an up on that. Read everything. If you have to say, don't go to Google. Why they tell you that? Because they don't want you to find out their bullshit. Go and Google, figure and type in what you don't understand, and Google will tell you exactly what you need to know. That's why they tell people not to go to Google. Why? Because they don't want you to find out they screw up. And let me tell you something. You don't think doctors go to Google? Hell yeah, I saw a few of them do it. Go right to Google. Type in what your problem is. I caught a couple of. They go to Google just like anybody else. So what makes them think that you don't listen? Go every right to do so. Something that's odd in your medical record and it says something, you have every right to question the doctor. And if he tells you, oh, don't believe everything Google say, well, you know what? Go to the reputable sites. There's reputable health sites that you can go to. IH, those are all the CDC. All of those people could tell you exactly what the hell it means, and they cannot dispute that. I'm telling you people, get a on that right here. I got something out of it. Guys, very, very